Hello everyone and welcome to our next episode of Transforming Healthcare, the people behind the progress. Today I'm joined by Damien McCallion, who recently marked 1 year as Chief Technology and Transformation Officer within the HSE. Over the past 12 months, Damien has led some of the most ambitious and impactful developments in digital healthcare in Ireland, from advancing the Digital for Care 2030 framework to launching the national HSE Health App and supporting our award-winning teams across the system. In this conversation today, we'll explore the journey so far, what it means for staff and patients, and what's coming next as we continue to shape a more connected, person-centred health service. Damien, you've just marked 1 year in the role of Chief Technology and Transformation Officer. What moments stand out for you as highlights from your first 12 months?
I suppose the first thing that strikes me, Joyce, is really the people side. The amount of commitment people have to the whole digital transformation, whether it's our own staff in technology and transformation, be they nationally or locally. And also then in terms of the clinicians, the people in the services, the departments, so across the board, patients, partners, even some of the people we work with, the providers and so on. So I think probably the most impressive thing and the thing that struck me the most is the number of people who are absolutely committed to this and who are really working hard to try and make sure we get the value from the investment that's growing every year in digital. At an individual level then, I'd say some of the achievements over the last 12 months that has been delivered through the team has been firstly the patient app, so the patient facing piece of things that we have under Digital for Care. And the team that have worked on that have done phenomenal work to get the first release, and the next release is just going out at the moment, and we plan to keep doing about 3 releases every year. So we'll see constant incremental improvement, as the app is obviously contingent on what's behind it ultimately as we build up the systems behind. The other piece then is around the systems for our staff that ultimately support patients and provide information to patients, and those are things like the diagnostic systems, further rollout of the NIMS system, the Medalist system going live after a long history in Beaumont Hospital, and I visited the hospital when it went live and it was really positive experience out there. Still issues to be resolved undoubtedly, but some really positive impact. If I look then at our electronic health record in maternity, and look at the work that was done in the forensic and rehabilitation hospital, some of which sort of transitioned through the last 12 months and prior to that. But those electronic health records, we can see real benefits there, which sets a great marker for the future. And then if you look at some of our infrastructure areas, commencing the Wi-Fi project, starting to roll that out, the cyber programme being advanced and having our further annual audit and National Cyber Security Centre audit. And also then around Health IRL, which has been running for many years. And successfully completing that was a phenomenal project. Sometimes is in the background. That's probably the challenge with some of our infrastructure areas. It doesn't get the attention perhaps that the more patient facing and service facing things do, but they're equally important. And then you could go through a range of other areas in terms of projects that have been delivered. So I think if you look at it from the patient side, we've set a good foundation for the future. If you look at the service side, we've got a lot of implementation of electronic health records, diagnostics, and indeed in other areas. I won't go into them all here. Then if you look at the area, like I say, in terms of some of the partnerships we've built up with GS1 around, just recently agreed that we will standardise around the GS1 coding system, around the agreement, the MOU with Health Tech Ireland, which has really improved our collaboration with industry. So those sort of standards areas as well. And the last area that I would say is really the focus now on data. So we got agreements with the CEO and the senior leadership team to appoint the first Chief Data and Analytics Officer. Our colleague Tom Laffin has stepped into the mould there, and there's a lot of work going on around data, analytics, artificial intelligence, and the importance of data for the future I think can't be underestimated. So starting to put in a focus on that, perhaps alongside all of our solutions, alongside all the infrastructure and cyber, those very important underpinning pieces, and all of those, if you think about it, tie into our 6 principles around Digital for Care. So a lot gone on in all of the areas by all of the teams, and that's been done, as I say, through the work of people within our own teams, out in the regions, services on the ground, and it really is all about collaboration. Ultimately it's people that will drive it on. The technology is important, but in itself it won't achieve anything unless the implementation is done in such a way that it delivers real value for services and for patients.
Digital for Care is at the heart of this transformation. How do you see the strategy shaping the future of the health service in a way that truly benefits patients, staff and all citizens?
So I think when we look at digital, it's important to consider it in the context of the wider healthcare system and what we're trying to achieve, and that's about sláinte care, and that policy still stands through many years on. And in fact the oversight of our Digital for Care is managed through the joint Sláinte Care Board, which is chaired by the SecGen in the Department of Health and our own Chief Executive Officer Bernard. So it's really integrating it into the wider healthcare reform and making sure it's part and parcel. So while we have to deliver the programs, it's making sure they're knitted in with all of the wider reform. And probably the key thing I think that everyone has said, and all the evidence tells us, is if we really want to get integrated care functioning between services, community and hospital, within hospitals, that's where digital can play a key part. Having information available at your fingertips, being able to see information from services that don't exist within your own facility, for the shared care record. So it really is integrated care can be enabled through digital, but in itself it won't be sufficient. You've got to have the team working, you've got to have the pathways defined, you've got to have the structures. So I think the opportunity to implement Launch Care, digital can enable that and support it, but it must be integrated in with all of our other change programs that are going on, which is another part, as you know, of my own brief. And we're looking at trying to set out those change programs now more strategically. We had a really good session with our own board yesterday, the Strategy and Reform Committee, in relation to how we actually make sure we look beyond the 3 to 5 years, look out beyond the current challenges. And that's one of the pressures in healthcare. Every day there's pressure, there's emergency pressures, there's pressure on waiting lists, there's pressures on mental health, disability, children's services. So it's trying to, at the same time as dealing with those immediate pressures, looking out over the next 3 to 5 years. And many of our digital programs, by their nature, between the business cases, the procurement and the implementation, are multi-year. They're not easy things to implement. So I think it's aligning the wider strategy for all of those areas with our digital programs so they're fully integrated, and that's where we get the greatest value and the greatest benefit from a staff, service and patient perspective.
Damien, what tangible benefits are patients and the public starting to see, do you feel, from the digital transformation work happening across the HSE?
So I think the benefits from a public perspective will be gradual, Joyce. The first is in terms of the app and the benefits patient will get by getting information in one place that they know is trusted and safe. And secondly, we focused on maternity because we have the electronic health record in our maternity services, where women are able to get their appointments both for maternity and now for gynecological services. So they actually are able to see their appointments, and that's integrated into their app with all the normal things you'd expect in calendars and integration, from other things that we do in everyday life. So I think we're starting to see some benefits for patients through that. Secondly, then, through our the work that digital communications are doing in relation to the way we deal with the public around being able to pull information together. So if you look at any service type industry, they'll have a really good way of pulling information together around us so that they can deal with whatever our issues are, our demands are, our concerns are, our queries are on the particular service we're getting. So HSE Live and that whole process there has been modernised in relation to how we're trying to pull that information together to support the public, instead of multiple phone lines, multiple channels, just really trying to consolidate. And that'll be a gradual process. And we're working with digital communications, Ben Cloney and his team, very closely to develop that out over the next couple of years. We learned a lot from COVID in that regard, where patients were able to book their appointments, see their appointments, follow their vaccination record, get their tests booked, and get information in a really clean, consistent way about healthcare. In that instance, it was about one disease. It's obviously more challenging when you're looking at the wide range of services that we provide today. So I think for the patients and public, they're seeing some benefit directly, but also indirectly as we start to roll out electronic health records. If you look at the maternity services, a lot of the benefits that come for that while it comes to the service and staff, the patients are feeling the benefit of that, even though it may not be as visible. So all of the information is available at your fingertips for any woman who's going through birth in their maternity journey. So all of that is there, that's digitised. And again, we're looking to see how do we feed that into the app, because we have that electronic health record where women will be able to see all of the information relating in a totally open and transparent way. So it provides opportunities as well as some of the things that we've delivered already. And I think those sort of service investments are needed, because ultimately patients will get good information, be able to transact if we've really good systems running our services, supporting our staff. So those two things are interlinked, and we'll hit a wall if we don't continue to invest in services and solutions for our services that mean that we standardise our practice. And that's probably one of our biggest challenges that we may touch on later, is how do we get that level of standardisation so that patients ultimately get the information, whether I'm in Donegal, North Dublin or Kerry. The information I see is open, transparent and consistent. And that's really important, particularly in the world of AI and all of these things now, that people see that information, can trust it and know what it means.
For staff, whether clinical, operational or technical, what do you feel are the biggest opportunities that digital health presents, and how are we supporting them through this change?
So I think I'd see that from two perspectives. One, in terms of doing their job, in terms of people out there in the services that are working there, and secondly, our own staff, or the people who are working in the teams then who are actually implementing technology. So I think for staff out in the services, we have a whole programme around digital literacy. And again, as we look to roll out electronic health records and I suppose permeate more services than we have today, our community, for example, is very Spartan. We haven't really invested there in technology the way we have in our hospitals, even though our hospitals are still below the bar of where we'd want them to be. You know, on the international index, if you look across the EU 28, we feature at the bottom of that, and we're determined to move up that table. And we can only do that by investing in digitalisation of our health records. So I think in terms of our staff, that's about the digital literacy, it's about good training around the solutions, it's about good support. When I was in Beaumont with the medalist system, they had, I think it was the bees, the people with the yellow t-shirts, all sorts of staff from all sorts of disciplines, supporting people who were trained in the system, helping them through those initial days that are so crucial to landing a system successfully. They trained, I think it was around 3,000 staff in a short period of time. So it's those sort of innovative approaches, I think, as we're implementing solutions, making sure we factor in the training, support people, not just on the go live, but post the go live, and maintaining that through. So I think that's the first piece. And that wider digital literacy, although there is a view today that, you know, most people now of any age, young or old, use technology, but I think it's more about understanding in healthcare, what does it mean, what are the implications around safety and so on, and the way we manage data, so we give the public confidence. The second is then for the staff that are working on our projects, be they technical staff, be they clinical staff, administrative staff, whatever their background, and there's a huge amount of work been done through your own office in relation to the whole leadership development, training. There's a wide range of training programs there to support, but also things that are perhaps more informal, peer-to-peer, some of the middle management development programs. You know, we have, I think, one of those events just coming up at the moment in relation to the presentations. I was at our last event, and some of the ideas that people have are phenomenal, and some of those will filter through and be implemented, and we've seen that recently. One of the ideas that was there that day was around the whole succession planning and agile succession planning. We took that into our senior management team, and we're now trying to roll it out. So I think it is about supporting people, not just the technical people, because now our teams really are hybrid. There's administrative people that are crucial to those teams, there's clinical staff that are crucial to those teams, and it's about giving them the development opportunities as well, so they can learn and grow, whether they're a pharmacist, a nurse, a consultant, you know, whatever they may be, alongside all of the more traditional areas. And I think that's a change we're going to see. We're seeing it in the system in general. It's less about unidisciplinary working. If you look at child and adolescent mental health, disability, it's all about team working. And we're seeing that now in digital, where it's all the various wings of technology, be they the architecture, infrastructure, you know, project management, etc. But you're also seeing then clinical and administrative and everything having to come together, be they HR, be they procurement, to work as a single team. And when we're looking recently at our electronic health record project and how we start to stand up the structures, you know, there's procurement work streams, there's HR work streams, there's technology work streams, there's service transformation, there's a PMO. So there's a whole range of things that we have to get, and that requires different skills. And I think there's lots of opportunities for people. In the last few years, we've grown the workforce substantially within the whole digital area, but also it's bringing opportunities at pace. And I do think we have to make sure now that we settle that down and get a rhythm around the programs, because they're going to, you know, there's so many programs now commencing or coming to that sort of boiling point where they're starting to move into the implementation phases or close to implementation phases. And that's about getting the rhythm and getting the governance right and supporting people to let them do their job.
We're seeing momentum around the electronic health record programme. Can you share why this is such a critical investment for modernising care and how it will support clinicians and patients?
So the electronic health record is the most important project we have, and it'll be the apex of everything that we do. If you look at all modern healthcare systems, the vast majority of public health systems have electronic health records, either a single system perhaps in smaller countries or regions, or a number of electronic health records in larger countries like, say, England with the NHS. And they're at the fulcrum, and a lot of the other pieces then hang off that. In some ways we've implemented some of the pieces on the outside, or starting to implement it, but we haven't got our core. So that's a gap, and that's one of the reasons we advanced the business case last year. We put a team together to work on this, led by Martina, and there's a huge amount of work gone on over the last 6 months to get a preliminary business case. I think at the board level, when we got through the board, you know, was recognised the amount of work that has gone into that is phenomenal. But it's a big programme. It's going to cost, you know, well over a couple of billion in terms of the indicative figures. That's for all of the costs now, the staff costs, the hosting, the software, it's all the components that make that up. And As a result, it clearly needs a very strong governance structure, needs to go through a very strong approval process. And at the moment where we're at is we're going through what's called the external assurance process with our colleagues in the Department of Health, and then we'll move into the major projects assurance with the Department of Public Expenditure and Reform, which is the standard process, having gone through the internal HSE approvals. So we've invested heavily, we're growing the team, we've appointed strategic advisors, we're also appointing legal advisors at the moment, we're building up the capacity within the team, recruiting in some of the senior roles. Our clinical lead role for the electronic health record was just advertised last week, and again we're encouraging people to come forward for that, Joyce, in terms of the opportunity that presents to really drive the change. So I think in terms of at a very macro level, it's clear in all health systems electronic health records are the heartbeat, and we need to move that forward, and hence we have. That's not to undermine the work that's happened already in places like the Forensic Hospital, the Rehabilitation Hospital, the ongoing work in St. James's, but also the maternity project, which has been really successful. And ultimately the reason we're doing these projects is about improving care, improving the safety of care, the quality of care, giving more information to patients. And the business case is largely predicated on those elements. And we've seen that in terms of the benefits process that's been put in place around the maternity project. It showed real value in releasing nursing time, clinician time, in terms of better safety, medication errors, transcription errors. There's a whole range of areas where benefits have accrued, apart from things like the cost of running paper charts and so on as well. Some of them can be intangible. The fact that you now have all the information at your fingertips, where before perhaps it was in a chart or may not be in a chart, or you can't find the chart. And anyone who works on the ground will tell you the challenges that exist there. So the really strong evidence coming from the maternity project, and the last 2 sites are going live this year. The team are working on that at the moment, Limerick and the Coombe, in terms of the standalone maternity hospital. So really good evidence base from what we've done, albeit in a small scale relative to the size of our system. But a maternity hospital on its own is a very significant challenge to move from a paper environment and transition across. And I think that's given us all a lot of learning, particularly, Richard Green, our Chief Clinical Information Officer, has clearly driven that with the team and has done phenomenal work in that implementation. And as I say, the benefits study that's come out of it is very, very powerful, and we probably have understated the benefits that have accrued from that programme. And certainly when you talk to some of the people working in the services there, it's really powerful in terms of the benefits we can get. So in summary, Joyce, we're way behind on that, on the electronic health record. We need to move it forward. We're moving it now at pace through the various approval processes. We put our pre-market consultation notice out so that we're paralleling some of our procurement steps with the approval process, and we're standing up the team to develop the requirements in parallel. So we're really trying to get some pace into that programme to try and make sure that hopefully when we get those approvals, we can move forward then into the full procurement stage and implementation. And we've already selected our first region, which is Dublin North East, and we've been engaging, and the team have visited and talked to a number of sites across the world, in the UK, in Northern Ireland, in Canada, in Australia, and in mainland Europe, to understand how to successfully implement these programs. Because it is a big program, with that comes a lot of risk. We have to make sure that we have the right governance, assurance, team structures in place. So a huge amount going on in that area, and it's really exciting. I think the potential that's there to improve care. I went on one of those trips myself to Barts to see Barts in London, number of hospitals covering 2.5 million people, and the benefits they've accrued over the years. They're 15 years live with an electronic health record. 15 years. So we have a lot to do to catch up with that. But I'm confident, and some of the clinical colleagues that went on that and management team that came from Dublin North East, there's a lot of exciting opportunities. Hard work to get there, but a real lot of opportunities to benefit the service and improve the service and improve patient care most fundamentally. We're not just digitising for the sake of it.
You mentioned earlier the lack of digitisation within the community space. What can we do you think, to maybe solve that situation, or to put something in place in the community while we wait for the EHR?
So we recognise the community, unlike the hospitals, that while the hospitals are still well behind in terms of electronic health records, they do have some basic foundational systems around their patient administration systems, their imaging systems, and so on and so forth. And most of our community services are Spartan. In my old role as Chief Operations Officer, one of the areas that we came under scrutiny from the Mental Health Commission was our CAM services. And the observations there were so strong in relation to the lack of IT for very basic things. Huge concerns raised in terms of the way we were managing our processes. And interestingly, the one service that scored slightly better or fared slightly better in the audit by the Mental Health Commission was one where we actually had a digital system in place. Not because of the system itself, because it enabled people to manage the service and understand the demands in terms of children, how those children were flowing through the system, capturing information around that and being able to do good audits and so on. So that was a good example. So as a result, when we looked at the strategy and policy around electronic health records with the Department of Health, we recognised that programme is going to take many years. It's substantial in scale, and hence we agreed that we needed to make an investment in the community in the intermediate piece that would transition the community from a fairly barren area in relation to technology, and hence a Community Connect project. Because we already had a project running, a number of projects in the community, we brought those together to roll out what we're calling a sort of foundational system, and the project's called Community Connect. It's been chaired by one of our regional executive officers, and the plan is to accelerate that over the next 3 years maximum, so that would be in place before we commence the electronic health record in Dublin North East. And that is just to give some foundational capability, give the community a lift up in terms of what they need to support them doing their job at a very basic level. But it also means when we come to transition to the full electronic health record in a region, the community at least will have been used and familiar with using basic technology, and hopefully most of the focus then will be on the integration with the hospital and other specialist services, because otherwise the jump is from paper within their own service and then integrating in with hospitals as well. And bear in mind, we're looking at voluntary, statutory, non-statutory hospitals and community services working together in a region. So when a region goes live, it's a very substantial engagement, and hopefully this will help to give something in the interim that will help manage the services in the community and support them, and B, when we come to move to electronic health record, there's a foundation there that will facilitate that move across then to that fully integrated electronic health record.
Damien, we've seen a strong emphasis on collaboration across services with clinicians and with the Department of Health. How is this helping accelerate digital health progress, do you feel?
So collaboration, and I mentioned at the start in terms of people, is really important. So I guess the first thing is we've really good support from both ministers that we've had to work with in the last sort of couple of years. And the new minister has been very supportive in relation to digital in any of the initial engagements, and obviously she has a very wide and varied brief, but there's been really good support by the Department of Health as well, from the Secretary General down to the Assistant Secretary, Derek, who we deal with around the whole digital area. And that partnership is really important. That doesn't mean that we shouldn't be challenged about making sure we maximise the return and we manage those implementations, but we've had really good support in terms of capital funding, in terms of growing the workforce over the last number of years. We've grown the digital workforce substantially. We still have areas where we don't have sufficient numbers, we know that. But also it's a fine balance here in terms of what we need to strike and where we put those resources. So really good collaboration with the department at the policy level in the development of Digital for Care, in the implementation of it, in the funding and the support of the programme. I don't think we could ask for more in terms of the support we've had over recent years. The other collaborations that are important then is obviously patients and our patient panels, and it's about making that meaningful. The HSE as a whole, through the work that Joe Ryan and the team in Lola are doing around the whole patient engagement, patient panels, patient forums, and a wider community engagement and so on, there's a huge amount of work going on there, and we're trying to leverage that. And Richard Green is doing a piece of work around how we pull people who are involved in the various projects from a patient perspective together to make sure they're supported and there's a cohesion to that. Because it can be a lonely place to come in as a patient advocate, even if there's two, and we should always have two, onto a steering group, onto a project, where you have a whole lot of people whose full-time job this is, and you're coming in as generally in an unpaid capacity to support that. The CEO has also made a priority of patient involvement, so there's regional roles that have been advertised, full-time roles, paid roles to support and enable that to happen, but we will still need those advocates and patients to support the change. And the greatest voice of any service, be it a digital investment or any other service, the greatest supporter, if you can convince someone that it's the right thing to do, will be patients. So I think that's a very powerful collaboration. The other is industry, where we've done a lot of work with Health Tech Ireland, the memorandum, and we've seen real tangible things there where we're working with them around procurement, working with them around innovation, and working with them in relation to making sure they understand our service plan process and we understand perhaps the challenges they face and their members face around that. So those sort of collaborations are also important. And then the many partners we have in the healthcare IT space and in the IT space in general. IT is something you will always have a wide range of partners that you work with, and making sure those partners are effectively linked to us clearly, measured at the same time. We're paying them, so we do need to make sure we're getting the right return, the right outputs, but also working in a collaborative approach, we can achieve the greatest results. So I think whether it's with the colleagues in the department and the minister, whether it's with the patients that support us, whether it's with industry, or with any other array of partners like academia, our chief academic officers now, we have one in each region, are also involved in many of our governance structures. And through the work that Tom Laffin is doing, we're looking out more into other parts of industry that would use data from the health service and research. So there's a whole range of other collaborations I think that we will need to develop, but there's a really solid foundation from the work that people have been doing over the last couple of years in that area. And as I say, the MOU last year was a big point with Health Tech Ireland. That was an important milestone, but we've already seen great movement. But that's a collaboration in itself. It's not just digital, it's procurement, it's the medical devices team. They've had talks recently from the head of our radiology programme, the head of our laboratory programme. So it's very much a HSE-wide collaboration, and I think that's important as well, that it's not just digital in isolation.
You mentioned innovation. How do you see it continuing to flourish within the HSE, and what do we need to do you feel, to keep that momentum going?
So there's a couple of areas or ways that I would look at that, Joyce. The first is innovation within the HSE as a whole, not just from a digital perspective. And the CEO, as part of the restructuring, had asked me to take on that responsibility. So Lou O'Hare and Richard Green are doing a piece of work around developing an innovation framework that would effectively ensure that we're prioritising innovation in the areas where it's of greatest benefit to the service, that we have a common way of evaluating it, that it's more incorporated into our service plan. One of our criticisms is we've lots of innovation all the time in the health system, but we don't manage to scale. So it's how do we turn that around and make sure that the really good ideas are scaled and rolled out quickly. And that is a challenge, while still recognising innovation happens every day in all parts of the health system. So that framework now is well advanced, and again we've had all of the normal collaborations in that around patients, industry, services, and both medical, hospital and community, and very varied voluntary partners and so on and so forth. So huge amounts of work going on that, and I expect to take that to the senior leadership team in Q3, myself and Colm Henry as Chief Clinical Officer. So that's the framework at the macro level. In the digital area, there's a huge amount of innovation. The pace now of AI, we all see it all the time. You just go in and look at something. I had a couple of holiday destinations the other day. I was thinking of going to put the two of them in, and it gave me an analysis back. If you want to do this, this is where you go. If you want to do this, this is where you go. And the detail was phenomenal, and it was back in seconds. So apply that to the medical world or the services that we're in, there's huge potential. So we've stood up the AI and Automation Centre of Excellence. I think that's really important, and that's becoming a breeding ground for trying to support that. Tom Laffin then is heading an AI strategy, which is just going to conclude. We brought it to our board strategy committee yesterday and briefed them on it, and there was a very positive response to that, and that'll be launched hopefully by the Minister at some stage, maybe in Q2 or Q3. So that'll set, with the strategy, there's a framework that will set out how we're going to deal with all of those potential opportunities in a safe way, but equally grasp the opportunities as well, not to be afraid of them. So there are legislation that we have to be concerned with, the EU AI Act. We need to make sure there's ethical standards, but we've brought all the elements together. So we'll have the strategy developed jointly with the department and launched by the Minister. We'll have a framework for implementation for people who want to do things, and HICWA are doing a set of guidelines in relation to how you can make sure what you're doing is ethically correct and the way in which you should approach it. So all of those things are going to be delivered certainly on our side this year, and the HICWA piece probably later this year, early next year. And that will facilitate a lot of the AI work and automation work that's already going on in the services. So I think in that space, we've done a lot of work to try and position it strategically, but actually practically then having things going on. Whether it's, I know you've talked to Peter McMahon on the radiology side before, but there's lots of other areas where there's work going on around identifying patients who are potentially at risk of coming into hospital, so that we can get to them earlier and link them into our integrated care teams for older people, which is the ICPOP teams. So instead of those being in isolation. So, there's a huge range of what I call proof of concept going on at the moment. And we have a national tender for stroke AI as well, which is the first national tender for AI products. But AI is everywhere. You buy a CT scanner today, AI will be embedded into it. When we buy our electronic health record, AI will be embedded into it. But equally, we have to make sure we have all of the normal sort of guardrails or safety checks or whatever way you want to describe it built around it. So a lot of potential in that area. And I think as the big programs move forward, we need to look at those innovations as well to keep momentum, because those big programs by their nature take time, they're not easy, they require a lot of resources, a lot of commitment, and by their nature will take many years to implement in most cases, even if you phase them or whatever way you structure it. So I think in parallel having those innovations, that we look at those opportunities, whether it's on virtual wards and home care, whether it's around some of the artificial intelligence areas, there's too many to mention here. And as I say, that Sláinte Care Innovation Fund has also enabled some of those to happen, but it's not the only funding stream. There's lots of other funding streams, and the innovation framework for the HSE as a whole will allow us to make sure they're coordinated in the best way possible without stifling that idea and energy that you see when you go and meet people on the ground who are doing these ideas and who are actually coming up with these innovations and making them happen.
Damien, what do you think we can expect to see in the next 12 months around Digital for Care?
So I think a lot of the momentum that's been generated since Digital for Care was launched in mid-2024, I think next year we'll start to see a lot more of the various procurements and programs start to land out in the services. That's the first thing. There'll be a number of those projects that will actually go live in 2026 that have been built up through 24 and 25 at various stages. So I think we'll start to see a lot more pace on some of the projects. Some of the bigger projects like the electronic health record, it'll be about moving the procurement forward, about selecting a vendor and so on. So each project is at a different stage in the life cycle, and we're going to see that pace. So I think in terms of the priority programs, and we've set out 19 of those that we see as the strategic priorities, but there's lots of other important projects as well. I think that's where we want to focus our attention to make sure those programs are structured, resourced and governed, and actually designed so that they can deliver and deliver the value. That's number one. I think the second thing then is we've been doing a lot of work on our operating model. How do we organise ourselves to make sure we have the best chance of success, particularly with the new health regions and the new integrated care model? How do we actually organise ourselves to do that? So we'll start to roll that out, but that will be an ongoing process. It isn't going to be that this is it now and that's it forever. We'll have to adapt as we go. The regions themselves are adapting and we have to respond to that. Technology is changing and we'll have to respond to that. So that's an ongoing process, and that's probably an important message for people to understand, is that as we move forward, that change will end up being a constant thing and we should embrace it. I know that sometimes is easy to say, and perhaps if you're the one that the change is happening, it can be tough, but we will ensure people are supported through that. But the opportunities at the moment, when you look at the growth we've had in investment in digital, additional resources, and like every part of the health system, we'd always like more, but there's been a huge investment there. It's about how do we organise that to make sure that we can deliver. And I think that operating model is important in that sense. Organising ourselves for success is probably the easiest way to describe it, because the jargon sometimes can be a bit off-putting and misleading. So I think one is the programs, two is organising ourselves for success, and thirdly then I think it is about building up those collaborations, building up confidence with all our stakeholders, be it government, be it the various government departments, be it in the clinical community, engaging with a wider range of stakeholders. We have a phrase now in the electronic health record, but you could apply it to anything, which is patient-centred, clinically led, operationally driven and digitally enabled. And I know it can sound like a soundbite, but essentially it is about capturing those four main things: patients, digital, clinical, and that operational drive that's needed to make these projects work, because you'll hit lots of obstacles along the way, and it's important that we're governed and structured for success. So for me, if I was to break it into three blocks, it really is about trying to advance those major strategic priorities while still keeping the services running. You know, we've the largest infrastructure in Ireland in terms of health services, and there are people keeping networks and servers and desktops and everything else going and applications every day of the week. So that's really important. And sometimes I guess it's hard for people because they may feel, well, all I'm hearing about are the new things. But it is important that we keep that confidence going through sustaining what we have. So it's that underpins by that sort of maintaining what we have well, doing the job well, keeping confidence in the systems that we are deploying. That's really important. And then, as I say, it's about then accelerating those programs, building the collaborations that are there that will allow us to make sure that we get the value. Ultimately, we're not digitizing just for the sake of it. It is about generating benefit, whether it's about better, safer systems, better quality care, more information to patients, improving outcomes, reducing errors, all of those things that we know can make a real difference. That's ultimately why we want to do this. And I see a huge groundswell in the last 12 months when you go out to services. There are more and more people that talk to me and say, look, we want to get involved. Why haven't we got whatever it is in terms of digitalisation? So there's a massive groundswell, I think, of interest, and it's important now we capitalise that and get those people engaged. both at national level in terms of getting to those sort of standard solutions, and then regionally in terms of the implementation and deployment of those solutions, because that's ultimately where it happens, out in our 6 health regions on the ground.
Damien, thanks a million for joining us here today and sharing that insight into the people, progress and the priorities driving digital health transformation across the HSE.
Thank you, Joyce, and thanks to yourself and the team for all the work you do around promoting, and it's really important in terms of communicating what we're doing in terms of the team are doing around digital for care.